Hello, I'm Dr. Ashmina Khalsa. I'm the Senior Consultant, Obstetrics and Gynecology at Cloudnine Hospital, Lucknow Division. Hi. So there's an entity called missing IUD, IUD standing for an intrauterine device. A lot of us have always been, advised to have an intrauterine copper device inserted after the delivery, whether it be cesarian, whether it be normal. A good habit after the insertion of an IUD is that you always check the thread in your vagina after the first period ends. However, if you don't feel the thread, you should come back to your obstetrician to get yourself examined in case the IUD is missing. This examination can be performed very carefully and locally in an OPD setup with your OBGYN, where she'll make you lie down, have you in a certain position, perform a speculum exam. When she's not able to see the thread of the IUD, which is a white color mostly, it is labeled as a missing IUD. Now what to do? First, we need not panic. Sometimes the thread has already rolled up on itself and gone back into the cervical canal or slightly twisted into the uterine cavity. So at such a point, we must always refer the patient to our radiologist and have a scan done to check where the location of the IUD is. On a scan, we'll be ensured IUD remains intrauterine or it has probably slipped out into the vagina, or very rarely may have even perforated the uterus, but that is a very rare entity, mind it. Most of the time we'll get to know that on the ultrasound the copper T is in place. However, the thread seam may have rolled in, and that is why we have misplaced the IUD. In certain positions where the position of the IUD cannot be certain in the uterine cavity, a very next reliable test we can perform is an X-ray pelvis. In an X-ray pelvis, in relation to certain bony landmarks on the pelvis, it's easy to comment if the IUD has migrated out of the uterus. Out of the uterus means it has probably perforated the wall of the uterus, maybe due to a traumatic placement of the IUD or a weak uterine wall, and the IUD over the time had perforated. Now, this is a very serious condition where it has perforation has occurred, and the patient may require a laparoscopy or a laparotomy procedure for the recovery of such an IUD. Where the perforations have not occurred, it is a relatively easy procedure. It can be done in a daycare setup where you will be examined thoroughly by our anesthetist team, given a short kind of an anesthesia. Lying down on our OT table, we perform a very easy procedure called a diagnostic hysteroscopy, wherein we'll insert a tiny camera right into your uterus, see the exact location, hold a grasper and pull out everything. Now all this is done under vision, nothing is ever done blindly, so there's no chance that a doctor will actually end up injuring your uterus. If you're careless and you have never checked your IUD thread and it has actually been there throughout and you have not bothered to check the thread, what will happen over time is it will engrave the wall of the uterus. So there are two things that can happen. It can incarcerate inside the uterus. Secondly, it may have already dislodged lying in the vagina. At the time of intercourse, you or your partner may be feeling an abnormal pain. Or the third, like I described, is it can perforate through and through the wall of the uterus and lie in the peritoneal cavity, cause an unnecessary abnormal condition called peritonitis. So guys, it's very important that we all are aware of this condition. We check our IUD thread, and this is the only thing that can help us prevent a missing IUD. Thanks.